You know, in 2024, there was a performance dialogue, there was a joint annual review. The first State of Health report was produced in the history of Nigeria, which was launched very recently by the President for the year 2024. We expect that on an annual basis, that joint review will take place. The joint annual report, the State of Health report will be produced, so the Nigerians get a sense of where we are. We have a health sector that has had many years of underinvestments, but this administration over the last 2 years deliberately, under the leadership of the president, has invested, and many state governments are matching what the federal government is trying to do. So it's a continuous process, and it will take us some time for Nigeria's health sector to be the way we want it to be. But we have started that journey of transformation, and we have to continue on that path. And it is all of us. There's no one level of government. It's not just the federal government. It's not any of the state government. Here, the permanent secretary of Benue State is here with me, for instance. Yes, they are doing their part. The governor of Benue State is very committed. But we have to join hands between the federal government and state. And then the outgoing representatives are here from all over the country. Local governments also have to step up. We have civil society organizations and members of the press, media. You also have to educate Nigerians that health is one thing that should bring everybody together because it affects all of us. And with the direction that we have in the federal government, I think, and the states keying in, we're already beginning to see early signs that things are slowly improving, but they have to be sustained. And we're committed to making sure that Nigerians get the benefit of these improvements that we all the states, local governments, technical partners, federal government entities in the sector-wide approach review performance. And this meeting particularly is for the Southwest Zone and the North Central Zone. Is the last two zones. The four other geopolitical zones had their performance dialogue, and is to assess the progress that we're making together. And it is clear that some states are showing improvements in things like skilled birth attendance, attendance of antenatal care. In some areas, the performance is marginal, but we're also learning from each other. And just to put it in context, every quarter, about 20 million contacts are made with Nigerians through the primary healthcare system that has now been revamped. That means about 80 million contacts. Doesn't mean 80 million people, but it means at least 80 million contacts per year, which means that the primary healthcare system, imperfect as it may be, is beginning to pick up because of the reforms that this government started under the leadership of the president, and with the support of all the states, the local government, civil society and development partners, as well as Nigerians. Because it is all of us, including community leaders, traditional leaders, that have to demand for the care. Women should show up for antenatal care when they are pregnant, and they should have at least 4 antenatal care. And when they come to deliver, they should go to a facility where a skilled birth attendant attends to the delivery, and if there are complications, get them referred. And for vaccination, for population to ensure that our children are vaccinated so that we can prevent diseases that can cost them their lives.